Hi, I'm Kathy Fowler, and welcome to the winter edition of Healthy Montgomery Family Checkup. Our topic today, heart disease. It's America's #1 killer. In Maryland alone, heart disease accounts for 1 out of every 4 deaths each year. Howard Gilson, a cardiac rehab patient at Suburban Hospital, was one of the lucky ones. An avid Red Sox fan, he ignored the warning signs and nearly became another heart disease statistic. Howard Gilson, a cardiac rehab patient at Suburban Hospital in Bethesda, Maryland, was one of the lucky ones. An avid Red Sox fan, he ignored the warning signs and nearly became another heart disease statistic.
I decided that once the Red Sox were losing terribly in the 5th inning, that it would be a good time for us to go home. So I said goodbye to everybody and drove home, and then immediately told my wife that I was not going to bed, that I was going to go to the hospital. I had a very good test, thallium stress test 6 months prior. I thought I was fine. If it had turned out badly, there may not have been another opportunity to see a Red Sox game.
Gilson's story had a happy ending, but not everyone is so lucky. That's why the staff at Suburban Hospital's cardiac rehabilitation program want you to know your risk factors. Pay attention to your family history and be aware of the warning signs, which can sometimes be easy to miss.
For heart patients, actually, most of them that come in say when they were having their event or having their symptoms, they didn't think it was heart related. So most people are unaware what the symptoms are and how they present themselves.
Know what to look for. Heart disease is often called the silent killer, and many people don't even know they have it.
If you were able to climb a flight of stairs 2 weeks ago and you're not able to do it today, that's significant. That's something you need to report to your doctor.
I felt symptoms. I had a chest pain.
The classic symptoms of angina and heart attacks are, as you said, usually pain that's left of center in the chest, sweating, nausea, pain that travels or radiates down the left arm, a sense of impending doom.
So how do you know if you are at risk? Here are the facts.
The traditional cardiac risk factors include age, and that's arguably the biggest risk factor.
Your age counts. If you're older than 45 for men and 55 for women, you could be at higher risk. Family history also matters. Our avid Red Sox fan, Howard Gilson, had a triple bypass in 2007 following 2 earlier heart procedures over the past 20 years.
Well, on my mother's side, her 3 brothers all died in their 50s from heart attacks.
What else? Pay attention to your blood pressure, watch your cholesterol, and quit smoking.
Managing your stress, watching your diet. Heart-healthy diet's good for preventing any chronic illness. And knowing what your numbers are, knowing what your blood pressure, knowing what your cholesterol numbers are.
Eating a balanced, heart-healthy diet is critical. Patients at Suburban's cardiac rehab learn new tricks for healthy eating.
There's a very easy mnemonic, FRED, F-R-E-D, which helps people remember what foods to truly avoid. The F is fried foods, the red is red meat, the E is eggs, excessive amounts of eggs, and the D is heavy dairy products, heavy creams and cheeses.
I had to really be serious about diet.
And make exercise a priority. You need at least 30 minutes of exercise every single day. Cardiac rehab staff encourage their patients to get moving, and they usually get hooked.
I really have to do something almost every day, even if it's just walking on the treadmill or walking outdoors.
Once people complete this program, about 50% of them stay and use us like their gym, and they continue to exercise. So we have patients that have been here up to 20 years.
Make sure you watch your stress level. Stress and depression can impact your heart health.
Depression can come on with many kinds of illnesses, and very frequently people are very frustrated because it's a wake-up call for them that they are getting older and that their lifestyle has to change.
Dr. Schwartz also suggests other prevention therapies.
Aspirin has a huge role in terms of both primary and secondary prevention of first heart attacks and prevention of second heart attacks once someone already has a diagnosis of heart disease. Many of our patients are taking fish oil, which I think can be a good supplement if the dietary fish intake is low.
By staying informed and making changes in your lifestyle, you can reduce your chances of heart disease.
You just learn a whole new life pattern, that's it. And because there's no other options. The alternative is not really what I want.